Hi there, I'm Reid Magnaghi, and this is my patient Sarah today, and we're going to go over the corrective exercise curriculum. First, we talk about her medical history, and then we assess an overhead and single-leg squat, and while we were doing that, we saw that her knees were coming in, and so we're going to be going over that, and we're going to start on the first stage of the inhibitory step. So we're going to go over the inhibitory stage. When we're looking at her overhead squat, we realized that her overactive muscles could possibly be the gastrocs or the adductor complex, and her underactive muscles might be her glutes. So we're going to be going over that in the inhibitory stage. So we're going to have her foam roll out, and she's going to start with her gastrocs. And during this stage, she's going to cross her legs to add a little bit extra pressure, and she's going to be slowly rolling over that muscle until she finds a pressure point, and then she's going to hold it on that spot for roughly 20 to 30 seconds.
On the spot. Good.
Now for the next one, for the adductor complex, we're going to have Sarah here lay prone, and we're going to put the foam roller right on her adductor complex when she swings her leg out. And then again, slowly rolling until she finds a pressure point. And then she's going to hold it on that spot for about 30 seconds. And just kind of keep doing that until we get some myofascial release. Now we're going to do the lengthening portion of the curriculum. And so I'm going to have Sarah here walk up to the wall and stagger her feet, one foot in front of the other, and then push that bottom heel into the ground so we really get a nice stretch. And she's going to push the wall and then kind of flex the glute too while she does it. And that'll really lengthen out the muscle while it's getting a nice stretch in. And we're going to do this to both sides as well. Now for the adductor lengthening portion, we're going to have Sarah take a step to her right, nice wide stance. And then you're going to lean and you're going to get a nice stretch inside right here on the inside of her adductors. And that'll help lengthen that to help release the tightness, and so it's not overcompensating anymore. Okay, now we're moving on to the activation portion, and this is for the underactive muscles such as her glutes. So we're going to be doing some glute hamstring bridges, and we're going to have her raise up for a count of 2, and then eccentric movement down for a count of 4, 2, 1, and then we're going to repeat up for 2 count, and then back down for 4, 1. And we're going to do about 3 sets of this, probably about 10 to 15 reps each set, so we can really activate those glutes. Okay, so now for the next portion, we're going to be trying to strengthen the TFLs. That it might be overactive, so I'm going to have Sarah do a side plank and hold it. And we're going to do 3 sets of about 30 seconds. It kind of depends on who your patient is. I know Sarah's pretty athletic, so she'll be able to hold it. And the key is to not let the hips sag or drop down. Just keep that tight so we can strengthen those outer muscles. And now we're moving on to the integration part of the curriculum. And so I'm going to have Sarah do some 180 jumps, and we're focusing on her landing and her knees to make sure they're still going to be parallel and not diving in any way. Or jump and land, jump, land, and continue. And we're going to do about 4 sets of this, about 15 reps each. Make sure she's doing it correct. Okay, for the last part of the integration, we put bands around her knees and then near her ankles. So we have some resistance for her fighting against that internal knee rotation. So we're going to have her do some crab walks. She's going to do a side shuffle. And then come back. We're going to do about 5 to the left, 5 to the right. We're going to do four sets of that for about 20 reps. Okay, for the last portion of the integration, we're going to have her actually start doing squats, and we're going to be adding weight, and now we're going to be making sure her knees aren't diving in, and after all the training, hopefully they will not be diving in. So we're going to have her do some squats and assess. And we're having her on an assisted machine just in case if the patient feels uncomfortable, they can rack it anytime they can or want to safely.